All right, so now to make the introductions for our incredible panel, I will start with Dr. Dana SHANIS. Don't get her confused. She's a doctor. I'm not. I know, we share the same name. I call her Dr. Dana, but whatever works. Dr. Dana works for tonight's panel. She's a board-certified OBGYN and an active researcher at the National Institute of Health. She recently founded V Health and Wellness, a private practice specializing in cancer survivor care, pelvic pain, and sexual health. Dr. SHANIS is passionate about empowering all women to improve their quality of life through education and support. So thank you so much for being here. And Danielle McKenna. She is a genetic counselor at the Basler Center for BRCA at the University of Pennsylvania. Danielle works with people prior to their genetic testing to help them understand the process as well as help them navigate what they learn once the test results are available. And Dr. Lindsey Hoskins is a couple and family therapist in practice in Washington, D.C. area whose clinical areas of interest include medical family therapy, genetic issues, and dating and relationship development. And last but not least is ERIKA STALLINGS, who's an attorney currently working in the music industry and is a BRCA mutation carrier. She's one of the founding co-chairs of the Basler Young Leadership Council, or the YLC. She lives in New York, and you may recognize her because ERIKA is not just an incredible part of all these YLC events, but she did just recently strut on the runway at New York Fashion Week and did an incredible job. So please, give all of our panelists a round of applause, and thank you so much for being here tonight. All right, so let's get started. And I'm going to stand because I think the cord is a little bit dangerous, so we'll just navigate. So I hope that doesn't make any of you guys nervous. So Danielle, as a genetic counselor at the Basler Center, what comes up in your clinic as background and information for BRCA carriers consider preventative surgeries?
So when we have someone who's newly diagnosed with a BRCA mutation, there's lots of different things to talk about. I'm just going to go back a couple steps. I think everyone here probably knows what BRCA1 and BRCA2 are, but just as a really quick refresher, BRCA1, BRCA2 are genes that everybody has. They're tumor suppressor genes, so they're supposed to be protecting us from developing cancer. Some people are born with a mutation in one of those genes, and then they're not getting that same level of protection. And so we talk about not only the lifetime risks associated with BRCA1 and 2, but we do focus a lot on the age-specific risks, because I think a lot of times when someone, especially a younger woman, tests positive, they read that 87% lifetime risk of breast cancer, and that can be really overwhelming and a lot to process. So a lot of times we'll kind of start with, yes, that is your lifetime risk. There's a range, but that is the lifetime risk. Right now at age 25, 26, however old they are, your risk is this small. And we talk about that, and that is usually pretty reassuring for a lot of people who've recently tested positive. And then we kind of go through different options, different ways to manage that risk, and what are your goals, what are you hoping to accomplish, what makes the most sense for you. It doesn't have to be a one-size-fits-all approach. So if you decide that you want to do the breast cancer screening for a while, and then maybe later you want to think about mastectomy, we kind of talk about all the different moving pieces that go into those decisions. And I work in conjunction with a physician who then can come in and have more of like the medical aspect of those conversations.
So what I think is really interesting here, we didn't ask this before we got started, but by a show of hands, how many in the room have a genetic mutation? Wow. And just out of curiosity, how many of you have been diagnosed with breast cancer? So about 50-50 in here. So we have a nice balanced crowd of preventative and cancer patients, and applause to all of you for coming out tonight and learning more about how to navigate your healthcare. So that being said, I think this is a really important question because I was diagnosed 10 years ago. And I was tested back then, and there's been a lot of genetic development since 2010. So for those of us that have been diagnosed in the room, have been tested many years ago, is there a benefit, or when, where, and how should we be thinking about retesting in the future?
So if you've been tested in the past and you've tested positive, there's not a whole lot of benefit to coming back to genetics. But if you were tested in the past and you tested negative, there's definitely some benefit into coming back. And so there's not a great cutoff point, but 2013, if you were tested prior to 2013, there's definitely a lot of changes that have happened since then. And then there's, tiny changes that are happening all the time in terms of technology is slightly improving, or we're discovering like one new gene that might be related to hereditary breast cancer. So it does change pretty rapidly. So I think it's a good idea, if you haven't seen a genetic counselor or a genetic provider in 1 to 2 years, you could even just check in and say, hey, has anything changed? Anything else that you would recommend for me at this point? But certainly if it was before 2013, it's definitely time to come back and see us.
Wow, really amazing. Haven't heard that before, so thank you for sharing that. All right, we're here to talk about sex. So, thank you very much. Dr. Dana. We know this is complicated, and we know there are so many questions that are wrapped up in this whole thing, and it's emotional, and it's physical, and it's traumatic, and there's PTSD, and we're like a big bottle of disaster. What doctor do we call?
So the short answer is you call me. But I think the more important answer is that you really should be talking about this with all of your providers that you feel comfortable with. I will tell you, I've been doing research and talking to oncologists for about a decade now. And when I started doing these talks 10 years ago, I would have like 3 oncologists wander in and out and weren't really listening that much. And recently, I fill the room and they're very engaged. And I think that oncologists are starting to understand the importance of sexuality and intimacy to your quality of life. And really, the better quality of life you have, the better you're going to do with your treatments too. So even though I will not pretend that your oncologist is going to be the one to treat it, but I think bringing it up to them is an important step. One, because they may have staff in their office that have been trained to deal with these issues. And so it might be a quick referral to people that are in-house. But I also think it's important for them to understand what you're going through. And so when that next person comes in and says, I'm having vaginal dryness, they aren't like, well, I've never heard of that before, you must be crazy. They realize how common it is. But in reality, they are not likely to be the ones who are going to treat you. Your gynecologist can be a very helpful resource. And I would recommend, as soon as there's a diagnosis, or if you have the gene mutation or are going to be doing preventative surgery, talk to your gynecologist before, during, after, and be really open and honest about what you're feeling, because there's a lot of things that we can do, and chances are you are not the first one who ever felt this way, and there are a lot of safe and effective options. So talk to everybody, but look for a gynecologist that you really trust to walk you through the process.
So that's a great segue. So I'm going to be really TMI here and super personal, because I feel like I'm in a safe space, like on the internet. But I was diagnosed in 2010 at the age of 27. I was engaged to be married. I eventually ended up marrying my now husband, and went through the chemo, went on hormonal suppressants, started the Lupron, went into the hamster wheel of just medication to medication to medication to worsening symptoms. And I did talk to my oncologist, like 4 of them, matter of fact, until I found this incredible, special woman at a gyno appointment that she had just joined the practice here in Philly. And I sat on the bed, the gyno bed, like you do. And I kind of went into my rigmarole that I was telling every single doctor. And she was the first doctor that turned around and said, we have options. And I broke down in tears in that moment, because it had been 7.5 years before I had a doctor tell me I had options. And so that being said, we find you, or we find a you, right? And we say, vaginal dryness, pelvic floor. We don't even know what these things are. I can't walk, it hurts. I can't pee, it hurts. I can't have sex, it hurts. So we put all of these things out. What's next?
So that's a really complicated question, but I'll give you kind of the categories that I see women most commonly have issues with, and kind of the first line treatments that we say. So with medication, with surgery, even just with the stress of a diagnosis, of cancer, there's disturbances in your hormone system. And so that is going to affect give you hot flashes, that could cause you to have decreased libido, that could cause depression, that can cause vaginal dryness. One little known issue that is very common in women who have cancer of all types, but even more profound in women with breast cancer, is pelvic floor issues. And that is both spasm, due to lack of blood flow and stress hormone effect on those muscles, but also you can have areas of weakness as well. So you can have dysfunction where some areas are tight, some areas are loose. That is a big source of pain, both during sex, but also walking around. You can get lower back pain. You can actually get pain all over your body from that. And with surgery, that's really, really common. So when somebody comes to me and they, have just gone through this, I try to assess, are the hormonal issues the problem? Is it physical? It's usually both. In terms of the hormonal treatments, typically we're not going to want to give you hormones. That's the opposite of what the treatment is trying to do. There are vaginal moisturizers and lubricants. I would say that, maybe 10% of my patients actually get adequate relief from that. And typically that relief is just so they don't feel like they're walking around with a sandpaper vagina all the time, which is a miserable feeling.
Okay.
So yes, you are not alone. You are not alone. It's really, really common. So that's really the first step. And then beyond that, pelvic floor physical therapy is something I actually recommend every woman go through. I see a nod here by our budding pelvic floor physical therapist. But basically, I would say that almost all of my patients, cancer survivors, have some kind of dysfunction in the pelvic floor. So the physical therapist will help identify and teach you how to relax areas that are tight, and through massage, which helps bring blood flow, stretching, and a bunch of different treatments. That is really, really helpful. By the way, cut me off because I could talk about this for hours. So, so make sure you let me know.
Okay. She's amazing. She can talk about this for hours, and we are all going to learn so much. So thank you, Dr. Dana.
So I think I'm going to jump over to Dr. Hoskins right now because you talked a lot about the physical, and something I did learn from you too. This is mental and emotional. And we know the emotional basket is a lot all boiled into one. Our bodies have been cut open and put back together, potentially mutilated to some extent. That's connected. Our partners have seen us go through that process. There's a lot of emotional trauma, not only in our minds, but in our bodies and in our relationships. So can you talk a little bit to the emotional side of what we're dealing with?
So I think, the emotional part can be really messy. It can be messy for you as an individual. It can be messy in your relationship. Or if you're single, it can be messy in terms of, looking at prospective future relationships. So a couple things that I really encourage my clients to think about and work on. So I'm a couple and family therapist. They said that in the intro. I work a lot with women who have a hereditary predisposition to breast or ovarian cancer from a BRCA or other mutation. And I work a lot with those women with their partners as well. And so on the individual level, I would really recommend that women just, first of all, give themselves the space to feel whatever it is that they feel, right? Because you're going to be sad, you're going to grieve, you're going to be confused, you're going to wonder why it's happening to you, why did it happen at this time in your life? And that's okay. Those are all normal feelings to have. And one of the things that kind of slows the progress of getting through that is when we feel something like that and we say, no, I shouldn't feel that way, and I'm going to try not to feel that way. It's actually the opposite that's effective, right? So, okay, this is what I'm feeling. I'm going to allow myself to feel that. I'm going to let those feelings happen to me. And I will tell clients, like, the feeling will get tired and go away, right? It doesn't want to bother you forever. So just let it kind of do what it's going to do to you, and then trust that you'll be able to move on to something else after that. So that's the big piece, like just giving yourself permission to be in that space. The same thing is true in your relationship, right? So it's important to kind of invite your partner to be part of that process in the way that you want them to, right? But also be kind of open to hearing what do they want, right? Because sometimes those are going to overlap a lot. Sometimes they're not going to overlap much at all, right? But the key to kind of navigating that is really just communicate. And one of the questions that was submitted from I don't know, somebody here said, what do you do with a partner who doesn't communicate? Well, that's really hard. And I would say in a perfect world, you would come and sit in an office with me or someone like me and work through that, but that's not always possible, right? So I would really encourage in that situation, helping them understand that communication is key, and really helping them understand that not communicating is also a way of communicating, right? Because by not engaging in the conversation, they're telling you something, right? Either I don't feel safe to talk about it, or I'm not ready to talk about it, or I don't know what to say, right? So being able to kind of go to the process level of communication and say, hey, there's this big thing that we're not talking about. Can we talk about why we're not talking about it, right? And that level of communication can be sort of a doorway into the other stuff.
That's great. And we're going to tap onto the partnership or non-partnership piece here in a minute. But I want to stay on the physical and emotional just for a moment. And ERIKA, I'm going to pass this to you because I couldn't look at myself in the mirror after my mastectomy. And I didn't feel good about my body. I didn't like the way I looked. And I could only wear a sports bra. My solution, AnaOno, right? You know, I took the tools in my toolbox and I said, if I can't, have something sexy, I'm going to make something sexy. And so I started designing sexy bras. I also tattooed a tattoo against my mastectomy scars in the shape of a demi bra. That's how desperate I was, just to feel beautiful when I looked in the mirror. This is 2010, so there were no topless pictures on the internet yet. And I was doing this kind of all navigating this on my own. So I think, ERIKA, it's really what I would love to hear from you is like, how do you find your sexy again? How are you reclaiming your identity and your sexuality, being out in the dating world, but also being a pre-vivor and somebody who's made a decision to do this? I would love for us to hear from your perspective. How do you feel sexy?
Yeah, well, I guess I'll back up a little bit, because when I made the decision to have genetic testing, I thought I was in a relationship. I thought I was in like the last relationship of my life. And part of the reason that I made the decision to undergo genetic testing was because my mom is a 2-time breast cancer survivor. She had breast cancer for the first time at the age of 28. And she's fine. Let me preface and say she's fine now. She's been in remission for the second time for 10 years. But she had cancer when she was 28 and I was 29. And I was also dating someone whose mother had died from colon cancer. And it had happened very rapidly. Like she got cancer, it was stage 4, and she died like 6 months later. So when we were getting serious, I was like, okay, well, if I could potentially have a really high risk of having cancer, I should know. So like, I don't put you through that emotional ringer again. So we've been dating for about a year. I decided to go get testing because I thought we were going to get married. He came to all the appointments with me, which in hindsight was, I think, a good thing. Also maybe a bad thing, because I think it put a lot of pressure on the relationship. So I get the results. I'm positive for BRCA2, and we break up a month after I get the results. Which, because I was like, well, yeah, I'm going to have a mastectomy, but it's fine because I'm with the person who has already decided that they want to be with me. And so I'm not going to have to put like these new breasts out on the dating market. Like, we're going to roll with the breasts that I already have, or like the reconstructed ones. So I want to answer the question, but what I will say is I didn't see a therapist until maybe 2 months after my mastectomy was done. And in hindsight, I really wish I had talked to someone at the very beginning. And my oncologist said, you should talk to a therapist. And I was like, no, I'm okay. And I was really trying to be strong for all these other people. And in hindsight, I realized all the ways that I acted out. Like, I bought so many clothes. Like I have things in my closet. Like I was cleaning out my closet and I was like, wait a minute, why do I have like these $1,000 leather pants? And I was like, oh yeah, because I bought those $1,000 leather pants when I was depressed, like when I got the results and I wasn't coping. But anyway, to actually answer the question about how I feel sexy, sorry. So one thing that I did before my mastectomy, because I was spending too much money because I wasn't coping, is that I paid someone to take boudoir photos of me. And I actually do love them. They are amazing. I have a bunch of them framed in my apartment. And that felt really good because I was like, you know what? If this is going to happen to me, I at least want to remember what I look like beforehand. And I think the biggest thing for me in terms of feeling sexy is I stopped hiding it from people. So I had the mastectomy in December 2014, and I spent a year of dating where I would like kind of try to hide what had happened. And I wasn't having any success, or I would have sex with people and they would squeeze the implants and it would feel really bad. And I was sort of trying to just like fake my way through it. And a friend of mine was like, people can probably tell that you're hiding something. And that's why you're not having a good dating or relationship experience, right? Because even if you don't think you are giving off vibes, you're giving off vibes that you're hiding it. So I think in like early 2016, I also write a lot about having BRCA, so it's like hard to lie about it because I'm so public about it. And I just decided like this is a thing that happened. It feels really good to be able to take control of it, and I just started like really, to Lindsey's point, being communicating with people about it. I didn't do it on date 1, but I would do it on like day 5, and be like, well, actually, you know, if you want to know more about me, I'm a BRCA activist. This is really important to me. I had a mastectomy. You know, if you want to talk more about what that means from a long-term relationship standpoint, you know, I'm happy to talk about it. So I think for me, the reclaiming my sexiness, it was a journey between therapy and other things, but a big part of it was just being open with people and not hiding who I was anymore.
So I think that that's a great segue back into the mind, saying, how do we cope with body image, right? I mean, this is a trauma that doesn't go away. I've been looking at this body for 10 years. I should see a therapist. But there's a reality that like these are scars that are in our lives every single day. They do not go away. So there's this constant reminder. So what advice to us do you say about body image or body confidence or the weight gain, the weight loss, the constant hormonal changes that we're going through? How do we continue to love ourselves in those moments?
Okay, so body image, I think it's an issue for women in general, right? Like it's just a thing that's hard to be a woman in our society and to deal with your body image. And then put on top of that things having to do with your breasts and your ovaries and your sexuality. It's just all it's a very tangled knot, right? So I always encourage my clients to really think about ways to use their experience to be empowered, right? And so when you look in the mirror and you see your scars, you get to decide what those scars mean, right? So are you going to look in the mirror and you're going to say, there's that ugly scar from when I had to have a mastectomy? Or are you going to say, that's the scar that means I'm a warrior and I got through that and I'm not going to let cancer get the best of me? Right. And really, it's just like I said a few minutes ago about sitting in the feeling. You can choose to sit in that feeling too. Right. So I would encourage a client to like stand in front of the mirror and just look at your body. Right. And just find all of the good things about it. And there are a lot of good things about it. Right. There might be things that you wish were different. And there might be a lot of things that you think are pretty great. Right. So I have really strong legs and I can run fast and jump high. Or I have strong arms that can lift my children and hug my grandchildren. Right. And really letting yourself kind of be focused on all of the things that your body can do and is capable of and is, you know, what all the wonderful things about your body. And I think the relational piece is so important there too, right? So being able to communicate with a partner if you're in a relationship and really allow that space for your partner to appreciate your body, because I promise you they still do, right? You're afraid of all the negative things that you think they might be thinking, and they just really want to be close to you and hold you and touch you and tell you that they still love you, right? And that can be just so healing, I think.
And by the way, I recognize it's a very privileged position. I was really fortunate. I actually took boxing lessons after I was cleared. I because I was like, okay, like I had this very major surgery. I want to do something where I can feel like I'm, in shape and taking control of my body again. So I got like a personal trainer who I was very honest with. I was like, I had a mastectomy. Like, I don't want to hurt myself. And so we actually would box like 3 days a week. And I got out I also had a really stressful job. So it was also really good for box, but I would box like 4 days a week. And it was just like really helpful to what you were talking about, sort of like feeling like, okay, like I did this thing and now I'm sort of like taking back myself and getting really in shape. So if you can do it, I would also recommend that.
I think body work in general, so boxing is a great example, but like you can do a free yoga video on YouTube in your living room, right? Like yoga, dance, any kind of like letting your body take on a new challenge and be successful right on the other side of this experience, I think is just really healing and empowering.
And I want to add something that's even easier to do, masturbation. So one thing that I will, sorry to just throw that out there, and we'll probably touch on it. Yeah, we'll probably touch on it in a second when we talk about libido, or whenever we talk about libido. But one thing that I find with my patients is telling them, not only giving them permission, but telling them you have to go and explore your new body. You have to, because I guarantee you there are places that feel good to touch. There are places that feel good to do whatever you do with it. And so, yes, maybe you have scars in one area, but maybe that's going to show you another area that you find pleasure. And I think that self-exploration in the form of masturbation is a very healthy way to kind of get that part of your identity back, that sexuality piece of your identity that doesn't require looking in a mirror, that doesn't really require worrying about what the reality of it is, because you make your own reality. You feel how you feel when you take the time to figure out what brings pleasure.
Isn't it weird that it feels good to get permission to masturbate? Right? Like, that's like a feeling. I'm like, yeah, like that your doctor just told you to go home and masturbate, ladies. I'm just saying that's a thing. But I think that this is a great segue because there is some technicalities to some of this. And one great question that came in, and I am going to say this up because we do want to open up questions to you guys or everybody that's brave enough. If you feel like it's a little too embarrassing, you want to write it down on a little Post-it note, we do have that too. So just kind of like raise your hand and we'll sneak a little piece of paper to you to ask a question. So we have about a 50-50 split. 50% of us have most likely been through chemo. 50% of us may have had hysterectomy or ovary removal or some option like that, or just the double mastectomy. Is there any research that's happening about the hormones that are being removed from our bodies, even if just from a double mastectomy?
So I did a literature search to try to find any research on that, and there's none. There are two possible mechanisms that it could decrease the estrogen in your body. Fat tissue has aromatase, which converts hormones to estrogen, and our breasts contain a fair amount of fatty tissue. So if you remove that, in theory, that could cause a small drop in estrogen levels. For most women, that would not be enough to be symptomatic. However, everybody's threshold of how much hormone they need to be symptomatic is different. So I've not seen any data on it. And so I said two things. So one is the aromatase. The other thing is that the physical and the emotional stress of surgery in general can cause a decreased production of hormone. So usually that's a temporary situation that usually resolves within about 3 months, but it is very possible. And I see women who have cancer in other areas that they do notice, a dip in all of these hormone levels due to the physical and the psychological stress of surgery. So that being said, the hormones are obviously very complicated, and you mentioned earlier that ointments may be limited. For those of us that are estrogen positive or have other hormone markers. So, we're hearing about O-rings and Mona Lisa and laser this and scrape that and do all of these things. So what can you tell us about some of the leading options that we actually have at our fingertips?
Except masturbation.
Which is required, yes. So one thing that I do want to say that even in women who have hormone receptor positive tumors, if they are in enough discomfort, vaginal estrogen is not contraindicated. So I have a lot of patients who say, no way, I will not go anywhere near hormones. But the absorption of the vaginal tissue, especially when it's been lacking estrogen, is very, very poor. So there are other options, which I'll talk about in 1 second, but I do want to make sure that you understand that if you need vaginal estrogen, a small amount of vaginal estrogen, it is unlikely to affect recurrence risk. So one of the questions I think somebody asked about Mona Lisa. And so one of the really exciting technologies moving forward that I think is making a big difference in my cancer survivors is laser vaginal treatments. So Mona Lisa is one type. It's a CO2 laser. There are like 10 different kinds. There are not head-to-head studies on the different types, but there was a review done last year on about 50 studies of different lasers in breast cancer survivors, and they show that there's a large improvement in sexual function, there's a large improvement in comfort, quality of life, and all of the measures that were studied. So the type of laser that I do is called the Diva. I liked the platform. I think that the handpiece is good, but Mona Lisa is also very effective. There are probably 20 different kinds. If you want more information about any of them, I'm happy to. I did a lot of research on all the different types before I chose, so I'm happy to answer any individual questions. But again, I could talk too long on it.
But there's options.
Yes.
That's the important thing to know. And that's, you need to find somebody like Dr. SHANIS that can help you navigate those questions. So if anybody's brave enough, we would love to open it up for questions. Yes. So what a great question. I'm just going to repeat it too so the live stream can hear us. So we're talking about not even just the emotional with the partner, but from a surgical perspective, having the deep flap and actually having tissue removed from your abdomen to regenerate the breast tissue is a numbness from almost your shoulders through your pelvic region, which can be an absolute surgical side effect. And I think this is a very real thing for many of us when you are not having or making love with your partner for not just 3 months, not just 6 months, but extended amount of time, mostly because of a libido, but then too, there's a pattern, I think, that starts to develop after that. So I'd like to pass this Dr. Dana and both. I think this is a very important question because she was the brave one to say it for all of us.
Yeah, thank you for that. And I think it's a very complicated answer because libido, more than almost anything else in medicine, is multifactorial. So she's going to talk about the psychological aspects, which can't be discounted. After this duration of time, even if you did have sensation, even if everything was working normally, there's going to be some hesitance and fear getting back into it. And so I think that it is really important not to discount that psychological aspect of it. And not to be a broken record, but where I would start is masturbation. I would typically, when you're trying to rediscover your own body, I recommend doing that by yourself and not with a partner, even if you trust that partner, because it adds another level. Often patients tell me that they feel, pressured, even though their partner so lovingly is saying, I want to make you feel good. If you don't feel good, then it's a failure. Or then you feel bad. And this is not about your partner. Even if it is about your partner in your mind, it's not about your partner. It's about getting some blood flow back, getting some of those hormones circulating that remind your body of the sexual cycle. And when you haven't been doing that in a while, it's very hard to get that going. So the first thing I would say is masturbation. There are also medications that will up your libido, and there's also procedures like, I don't know if anyone's heard of the O-shot, which is platelet-rich plasma from your own blood, which there are some complications of doing that during treatment, and which, if anyone has questions, I'd be happy to answer it individually. So there are some treatments. The laser actually can help as well, but what we want to start doing is physically overcome the consequences of the lack of hormones, and then emotionally start to get that cycle going again. So that your body can respond in the way that there is reserve in there. You are not too far gone. You just have to remind yourself of that. And I think that the more that you do that without the pressure of feeling like I have to orgasm, and that's one thing I should have said, that when you masturbate, the goal should be pleasure, not orgasm. Because I think that is a lot of pressure to go in, and I think that's not the goal. If you have pleasure, that is going to start that cycle where now the arousal process will be quicker, which means that the nerves will start to regrow, blood flow will be increased, and that cycle will start to improve all the way around. So I think baby steps are valuable to get the libido back up. And one other thing that's important is the vaginal tissue that doesn't have hormones and hasn't been stretched in a while may be very painful when it does get stretched. So even in the absence of, even if you're not going to do laser or vaginal estrogen or anything in that area, one thing that could be helpful is vaginal dilators. And starting at a very, very extremely small size. It should never be painful to use vaginal dilators. It should just feel like a little bit of pressure. And you can slowly go up in size, and that will actually stretch the tissue in a controlled way. Intercourse is penetrative intercourse is an uncontrolled way of stretching the tissue that leads to pain. So I think dilator use in that context is also very helpful.
100% agree with everything, all of that. Fabulous. On the relational side, as you're working on, by yourself with the masturbation and kind of getting that piece going, I think there are also baby steps that you can take in the relationship, right? So I love that you said the goal is pleasure and not orgasm, because that's true in the relationship as well, right? So can you connect with your husband in a way that's sexy, even if it isn't sex, right? And think about the range of things that meet that criteria, right? And start wherever you're comfortable and just stay in that space and enjoy it and connect, right? And as you do that, then the connection starts to grow, the passion starts to build, all of those good feelings start to come back, right? And the physical piece and the psychological piece really feed each other and support each other. I like to encourage my clients to think of like levels of sexual connection or levels of sexuality, right? And most people would put intercourse at the top. Like if there's 10 levels, that would be a 10. But what's a 3 for you, right? And can you invite your husband to come sit with you in a 3 and just enjoy that? Can you hop in a bath or shower together and just lovingly care for each other's bodies? Or can you just kiss for the sake of kissing, right? And don't have any expectation that it's going to go somewhere else, but just enjoy that connection and that passion for what it is.
So I joke that my next invention is going to be Cancer Karma Sutra cards. Because like I would just be like, hey, just hold my hand on the couch. I'd be like, that's a level of pleasure I haven't experienced in a while. And then you like graduate because it's very complicated. So thank you guys both for doing that. Any other questions? Yes. I'm just going to recap again just for the sake of the video, but what we're talking about is a beautiful, gorgeous 62-year-old who has been through a lot of reconstructive surgeries, 3 failed attempts, and is now wearing breast prosthesis and trying to understand how to navigate her life as an adult with even a side piece of a friend with benefits. But continuing to look at her sex life and her energy in the right way and how to really harbor that and use that and maybe find a partner, maybe something more than just a friend and feeling good in those moments. How do you, somebody who doesn't feel like unclasping that bra and showing those forms that have been stuffed into the pockets in that moment, how do you share like, hey, I'm not going to take off my bra because I don't have breasts in those moments, which I think is a really huge question. And I will tell you, one of our models, Jamie Lee, who we just named a bra after, has actually 2 breast forms. One are her ones that she wears out, and the other one she calls her porn star tits. So I'm just letting you know that there's those ladies out there too, and maybe you should have a conversation with Jamie because she literally turns into a different person when she puts those boobs on. All right, so we'll pass this over to you.
So I think the question was mostly about how to communicate with a new partner. Is that right? Okay. So my advice is always to be 3 things: to be clear and kind and honest, right? So you're just, this is you and you're putting it out there, and the more empowered you are about it, the easier it's going to be to talk about and the better the other person's going to receive it, right? And you also have to leave space open for their reaction because you can't really anticipate it, right? And some guys aren't going to be able to handle it, or some people aren't going to be able to handle it, and you just have to kind of be prepared for that. That's their shit. That's not you, right? And you just have to, accept that if that happens, okay, that person isn't ready to handle what I have going on, and that's okay because there's somebody out there who can. I mean, that's such a hard question. I get that question all the time. So I like to say it's probably not second date conversation, right? But it really depends on how well you're feeling connected, right? If you feel safe and if you're developing trust with this person and you feel ready to put that part of yourself out there, then I would say do it, right? Because I also hear from women who feel like they wait too long, right? And now they feel like they've sort of like misled somebody because they didn't say it soon enough, right? So there is sort of that fine line that you might feel like you're walking, right? And I would just say, listen, I have something to share with you that's not easy for me to share, and it might not be easy for you to hear, but I feel like we're at the point where we could have a difficult conversation, and is that okay? Can I share this piece with you? And if you get their permission, you get their buy-in, then okay, then you're just going to take it as it comes, right? And clear and kind and honest and kind of let it happen.
I'm not a psychologist, but I want to tell you that I bet that you are a lot harder on yourself than a lot of them would be. And while you might not think that they will find you beautiful, I am sure that there are many men out there that would find you beautiful. And so, I'm not saying that from a psychologist. I'm just looking at you and I think you're beautiful. And so I think that having that knowledge that you're being hard on yourself and that, that you're your worst critic, is maybe something that, when you go into those interactions, you might be able to, to see that they really see your beauty.
I think that this is a good segue over to ERIKA too, because some of us don't have nipples, right? So we may not have breasts, but we also don't have nipples. So there's I think a very parallel to that advice to those of us that are like, the boobs are there, but they're missing something. Maybe you could ask them to find it. I don't know. But ERIKA, you are a previvor, so likely you were able to preserve your nipples and your reconstruction. So what do you say?
Well, it's really funny because even before I had surgery, one of my friends in law school was like, you always make people sound like a sex contract. No, because I really like to talk about sex before I have sex to make sure it goes well. And so he was always like, I have this male friend who was like, every time you talk to me about like you're having sex with people, I feel like you make them sign a contract. But I think so. I've been with my current boyfriend for 3.5 years, and I think I probably talked to him initially about having BRCA on like the 5th date. And part of it was because I was going through my ovarian cancer screening, and it puts me in a really bad mood when I go to get those screenings. And he sort of picked up on the fact that I was in a bad mood. And so I said, well, actually, like, I want to talk to you about it. The reason, like, if I seem distant is because I have to go have this procedure and it makes me think about dying and I don't like it. So it was a good segue. And so before the first time we had sex, I said, well, I think we're getting close to the point we're going to have sex. And so I like to be upfront with people. I'm like, it's like day 5, so we're probably going to have sex. So let's talk about, my best friend is a man, so he's like, you can't do it before date 3, but you got to do it before date 6. So I was like, all right, day 5. I picked day 5. I was like, okay, so it's day 5. We're probably going to have sex. And I have implants. They've been there for 2 years. And, sometimes it feels good for people to touch them and sometimes it doesn't. So when we have sex, let's see how it goes. And, if something doesn't feel good, I'll tell you and we'll take it from there. So I don't know. I'm probably a little bit more upfront than people are, but that's how I approached it. I just said, I'm at a place where my breasts feel good sometimes when they're touched and sometimes they don't. So let's see how it goes. And if you hurt me or something doesn't feel good, we can either talk about it in the moment or we'll talk about it afterwards. And I would say probably the first few times we were intimate, he would be like, was that okay? And so we kind of just kept talking about it until we figured out like what felt good. And for me, I'm 5 years post reconstruction. So over time, it's gotten better and I have a little bit of sensation. But the first year we were dating, we would just sort of have little check-ins of like, was that okay? Was that not okay? That kind of thing. So it was just about establishing a dialogue.
Great, thank you. Any last questions potentially? Because we're going to probably wrap up here. Yes. Great question, because I think this is also, especially in long-term survivorship. So if you've had a partner for a long time and they've experienced this alongside with you, have become your caregiver, have seen you puke, throw up, give a suppository, be cut open, drain, emptied your drains, all of these things, you become somebody that somebody's cared for rather than maybe somebody that they've loved, right? Because you're kind of especially experiencing this at very young ages before you're old enough to kind of get that checkbox on your relationship list. So how do we deal with that mental piece of that level of survivorship when you're not immediate, but years out even?
So there's actually a type of therapy that I think would probably help you. It's called EMDR. I don't know if you've ever heard of that. It stands for eye movement desensitization and reprocessing. So it helps you sort of like process through what's become like a traumatic memory for you, right? And just if it's successful, which it usually is, people think it's weird, right? Because the therapist is going to like wave her hand back and forth in front of your face and you're going to follow her hand with your eye while you're talking about your feelings. But what it does is it connects the two sides of your brain in a way that's different from what normally happens when you're thinking about that. And it helps you process through those feelings and kind of be able to put them away in a place where they won't have to pop up so much anymore, right? So that would be a strong recommendation for you in that situation. I also think that, part of in the moment when that's coming up for you, that's an invasive thought, right? That's a trauma symptom. And really being able to get yourself as connected as you can to just your body and what feels good and what's going on. And that might mean slowing down, focusing more on foreplay, changing kind of, if you have it like a normal routine that you do when you have sex, like mixing it up a little bit. Maybe you get to be more in control of things. Maybe you share a fantasy or role play or dress up or something like that, where you really can kind of immerse yourself in a different part of the experience, right? So you're just changing the connection between what your body is experiencing and what your mind is experiencing.
I don't want to downplay it at all because I have been there. Did you ever read Ask Polly, which she writes the advice column for The Cut? So in her book, which she has 2 books, I can't remember which one it is. She has a chapter called True Romance, and she talks about how like we live in a society that tells you that like true romance is the fancy wedding, the fancy French dinner, getting flowers, and the whole essay is about true romance being like the night she had like diarrhea on like a fancy vacation and her husband like staying up with her, right? And so I think I think about that all the time, but I'm just like, no, because that's what marriage is, right? My best friend has had 2 kids and she talks about, being pregnant and vomiting and peeing on herself at the same time, right? And I don't know, so sometimes I'm just like, when you're younger, I feel like you think all that stuff, it's like, it's gross, but the reality is that like, if you're going to be married or you stay with someone long term, that's actually what it is. It's like getting through the shit and the muck and all that kind of stuff. So I totally get like why it's hard mentally, but I kind of just think that's like the reality of love is you're going to see your partner like probably at their weakest moments, and because you love each other, you just like pull each other through it.
One other thing that I see commonly when women come in, and a lot of times I have them bring their partner, because even though I am, an OBGYN, I think there's a ton of psychology in every conversation that I have. A lot of partners will open up to me and say, well, I saw them sick and now I worry I'm going to hurt them, or now I'm going to worry that they're going to get sick again. And I think that a lot of partners have a hard time getting past being the caretaker for you and looking at you as their partner again. And I would say that in a lot of those cases, it's their problem, not necessarily yours. And if you're feeling, embarrassed by that, then, there's room for you as well. But I think that a lot of times the partners have to be told that you are now healthy enough for sexual activity. He doesn't have to still give you suppositories unless that's the thing you like to do, in bed, whatever it might be. But kind of addressing that he did see you when you were in that vulnerable state, but that you aren't there anymore, and that that he can now resume treating you in the way that, that feels good, that he used to, when you weren't sick.
So amazing. Let's give a huge hand to the panelists for sharing so much. And I really want to give a huge hand, hug, love, energy out to you guys. I think it takes a lot to be here. It takes a lot to sit in these seats. This entire discussion tonight was built off of the questions that you guys sent in when you registered. So if you didn't ask a question tonight, we hope that we answered them in the discussion. This is a lot for all of us to take on. And I think as a patient, this is the piece of our lives that our doctors don't do for us. This is the moment that you have to empower yourself and find that energy somewhere to take control of this and really liberate yourself. And it's really, really hard because we're relying on them so much to give us the answers, but some of this just can't be answered by medicine. And I think it's really amazing that you guys are sitting here today and you are learning. And I hope that when you leave that you can share with your other sisters and tell them what you learned here or what, you felt that you took away from this. And this is a problem for all women and all relationships and all things. We might be escalated because of what we've been through, but I just really want to thank you all for coming out and being a part of this and really being open and honest and sharing your vulnerability with everybody in the room. So thank you so much.